We find that using SRS helps all our employees become more productive. Information changes hands much more quickly as a result of having SRS. If someone at one end of the office has to communicate something to a person at the other end to do something or to get something related to a patient, it's just instantaneous. No shuffling of papers, no running across the office, no picking up the telephone. There's a record of what's being done, of telephone calls that have to be made. So things happen much more quickly, they're better documented, and everybody benefits. We purchased SRS about 7 years ago, and we did it for all the normal reasons the common reasons that practices do this for, such as to save money in the long run, to eliminate some FTEs, to get enhanced efficiency. So that's why we did it. But and besides achieving all of those things, what we found was, and what kind of surprised me, is we give better patient care. And I'll give you an example. A patient will have a test, or a diagnostic test or a blood test, and we receive the results very quickly because we get most of our results electronically. They get to the doctor very quickly. The doctor either calls the patient right away, or through the messaging instructs one of his subordinates, his nurse, his medical assistant, to call the patient, tell them, make an office visit in a week, retest in a month, change your medication dosage. It all happens so fast. So patients don't sit at their houses waiting, when am I going to hear from the doctor? And day after day after day, it just happens real time practically. And consequently, patients are always telling us, you guys are the best. I get everything very quickly. I call your office, I get a quick answer to my question. And many patients who are referred to us, they want to stay with us even though we're specialists, and they're coming from a primary care doctor because they say, you get better communication, better service. So patients are very happy. That was not something we really anticipated. Yeah, we saved a lot of money by using SRS, and it's primarily from the reduction in FTEs, or staff. That reduction didn't come all at once, but as we did, we were able to eliminate clerical and filing positions. So and the cost of personnel is our highest cost. So you save a few FTEs, and that's money you save every year, and that's more than paid for the cost of the system. SRS lends itself very well to cardiology because we have a lot of high-tech equipment, and we have the SRS system interfaced to many of our equipment, our nuclear camera, our pacemaker reporting system, our echocardiography reporting system. So all of these modalities produce data and produce reports, and they come into the system paperlessly, and message to the ordering physician, and patient instructions just flow from there. So I think cardiology benefits greatly from SRS, and it's just helped us eliminate paper, speed up our communication, and just make us more productive and more efficient.